This is Chifente Village, TA Chegu in Upper Neno district. It is a normal day for one Martin Kadyakapita. Mr. Kadyakapita is in good health now. He goes around taking care of his household chores. He wakes up every day with energy and hope to fulfill his routines. But this would not be possible 5 or so years ago. On one fateful day in 2018, when he was living in Kasungu district, he just realized he had difficulties in breathing and walking. 1 week later, Kamuzu Central Hospital in Lilongwe diagnosed him with a heart disease. The condition worsened his health to the point of forcing him to quit his job.
Initially, a hospital in Kasungu suspected I had TB or asthma. But these were not found after their tests. When I was transferred to Kamuzu Central Hospital in Lilongwe, it's when they found that I had a heart disease. The illness hit my life so hard. My body was swelling up. I could not eat or wear shoes. I had short breath. I was in a very difficult situation.
Martin's 2018 condition did not just affect him as an individual. His immediate family and relatives were hopeless too. They feared the worst for their sibling.
This illness came as a shock to my relatives. They could not believe a once energetic man failing even to stand on his feet. I could not do any business, let alone work. I couldn't believe the transition from being healthy to all of a sudden falling this ill.
A year or so later, Martin transferred from Kasungu to Neno district. This was a major turnaround for Martin's health since he got registered into the Penplus clinic, which is under an innovative program called the Integrated Chronic Care Clinic IC3, which Partners in Health, also known locally as Abwenzi Pa Za Umoyo, launched in 2015.
When I got transferred to Neno, my condition was worse. Swollen legs, short breath, lack of appetite and proper diet. After Neno District Health Office reviewed my condition when I first visited the hospital, they quickly referred me to the Integrated Chronic Care Clinic, where they recommended that I should immediately start treatment.
In Integrated Chronic Care Program IC3, Partners in Health provides longitudinal care for patients with chronic conditions, including non-communicable diseases, NCDs, with a single primary care visit for all of their patients' conditions. The IC3 program has ultimately supported the Special World Health Organization endorsed model of NCD care called Penplus. The Penplus clinics in Neno and other Malawi's districts are offering decentralized and advanced integrated care to patients like Martin with chronic conditions such as heart disease, high blood pressure, type 1 diabetes, and asthma, among others.
Penplus project is one of our very interesting and very helpful project that we have, where we are looking at how best we can improve the care for NCDs. NCDs are also known as non-communicable diseases. So it was viewed that there was less concentration in as far as the care for NCDs is concerned. So Penplus came in as a project that wants to address increasing the accessibility of the care, especially for those conditions that are a little bit advanced. So technically speaking, 7 out of 10 people that die globally in a year, they die because of non-communicable diseases. Here in Malawi, studies have shown that the non-communicable diseases are increasing. Currently, we're talking of about 30% of people dying due to non-communicable diseases. Now, when you talk of Malawi, that is a big issue because we know that now people are living longer. Now, the more we live longer, the more we have the risk of developing non-communicable diseases. If we talk of here in Neno, for instance, we have close to 6,000 patients that are having non-communicable diseases. These are the patients that without projects like Penplus would have no access to care, thereby predisposing them to risk of dying prematurely. So the programs and the activities that we're doing, basically, they're aiming at reversing that and giving people the base as they grow old, as they develop these non-communicable conditions.
It's been over 3 years now since Martin Kadyakapita started accessing health services from Neno Penplus Clinic. He explains the package of care that he receives from this clinic and how it has tremendously transformed his health over the years since he came to Neno from Kasungu district.
During initial years of my treatment, I used to visit the clinic once every month. But now, I visit once every 3 months. This clinic has very effective client service. They give me medication that helps regulate water in my body, blood pressure and heart functions. This clinic is absolutely different from where I was in Kasungu because here I am served adequately and always the clinic has enough drug reserves.
Medson Boti is an advanced NCD clinician at Neno Penplus Clinic. He is part of the team that has been central in managing chronic conditions at this clinic. Boti explains his role and what he is passionate about in managing chronic conditions at Neno Penplus Clinic.
My role basically involves identifying such patients in health centers and also maybe when they are admitted in the wards and they start caring for them. So confirming their conditions and putting them on medications, doing investigations and also doing follow-ups. Penplus, PEN is PEN stands for Package of Essential Non-Communicable Diseases. So we have a wider range of non-communicable diseases, but there are others who are considered essential because of how severe or difficulties they bring to someone if they have been affected by such conditions. For example, we are talking of heart failure, we are talking of type 1 diabetes. If you have these conditions, your life is disturbed. So there are conditions that needs focused care, that needs a comprehensive care. So that's the word PEN. So plus includes every other non-communicable conditions that would be there. So we shouldn't just focus on these essential ones, but we should also focus on these other like mental health conditions and others. On top of that, we shouldn't just focus on prescribing medications. We should also focus on the social part of life.
Boti says the structured treatment procedure that Penplus clinics condition the patients to has helped many of them recover within the shortest possible period, counting from their first visit. Boti compares Martin Kadyakapita's condition the first time he visited the facility as a patient to now.
Martin Kadyakapita, we have seen that he has tremendously improved. Like, he is better than how he was before. Because when he was coming in, he had severe shortness of breath. He couldn't walk on his own. Someone had to hold him until he reached the hospital. He had swelling of the legs. He couldn't sleep flat because of shortness of breath. He was always sitting up for comfortability. But because of the medicines that he has been put on and the social support that he is receiving, he's better. The swelling is gone, the shortness of breath is gone. He can walk just like any other person. He stopped working because of the problem. Now the problem is gone. He was even mentioning some few days ago that he is even ready to go back to work just like any other person. So that is just an example of how these Penplus clinics can help someone.
Looking at his good health and what he is now able to achieve in his life, Martin Kadyakapita says he has crucial remarks from the bottom of his heart.
Heart disease is no longer a threat to my health, as you can see. I now have appetite and I eat. My legs stop swelling and I no longer have short breath. Heart medication is very expensive, I'm telling you. In Kasungu, I used to buy the drugs, but they were scarce there too. It's a different case here. With available drugs and free treatment here, my health is completely back to normal. I'm very thankful to Partners in Health for treating not only people with chronic conditions, but many others with various illnesses too. I urge PIH to continue the good job and support to their patients in Neno and beyond.
The Penplus project is one of the NCD care programs that Partners in Health is supporting the Ministry of Health program on NCD throughout Malawi. PIH provides technical assistance to the ministry's NCD unit, supervision, mentorship, and building capacity of healthcare workers working in all districts in Malawi.
In whatever we do, the ministry becomes our partner, and they're the ones that will guide us into what we need to do. And our working relationship so far has been very well, both here in Neno, with the leadership here, and also at national level. During COVID-19, we saw that most of the people that were dying were people that were having other comorbidities like hypertension, diabetes, which are basically NCDs. And this is the reason why us as a PIH, we do cherish the Penplus project, and we are trying our best to expand this. And our goal is to make sure that the whole nation, in each and every district, the Penplus activities have been implemented. We are able to reach many people with NCD care. Number two, using this type of approach of care, we have found ourselves reducing stigma among people living with HIV. Because when they're coming to these clinics, they're not coming as HIV patients. They will meet their friends that don't have HIV, but they're just coming for these services. At the same time, we're able to isolate those that are having depression, and we're able to intervene and help them. So I think these are some of the things that we have seen that they're very helpful, and we encourage other people to adopt the same approach because it is helping a lot.
Dr. Jonathan Chiwanda is the head of Non-Communicable Diseases and Mental Health section in the Ministry of Health. He acknowledges that the collaboration between the ministry and Partners in Health over the years has yielded meaningful results in Malawi's health sector, including the Penplus model of NCD management and its eventual rollout to pilot districts in the country.
Poverty Lancet report had shown that we've got a huge gap in managing a lot of complex cases, including epilepsy, asthma, sickle cell, as some of the examples of conditions that the patient would present, but maybe they're not well managed. So we are building on this to say we need to scale up the Penplus. So we started in 2011 with the PIH, and over the time we started in the Upper Neno district in 2011, and we scaled up to Lusungwi Health Center in 2013, and by 2015 we had already scaled up to almost 12 facilities in Neno. We are building on that to also give more capacity for the secondary hospitals to be providing complex management of non-communicable diseases through that pilot, so that we can build in over the time. We should be able to scale up to across the country, so that we should reduce in terms of referrals to, and also decongest the tertiary hospitals.
This is Ngwenyamatu village in TA Simon, Lower Neno district. These are blood siblings, Florida Kennedy and Fortune Dixon. Just like Mr. Martin Kadyakapita, these children too have a story that brought each one of them grief at some point of their life. Since childhood, 18-year-old Loida has had a sickle cell condition which her parents learnt about when she was 2 years old. As a girl growing up with this condition, she says her life used to be extremely tough. Her mind was cluttered by so many questions.
I was so down. I really needed answers as to what caused this disease in my body and when it will go away. At the peak of the disease, I used to have severe headache, stomach pains and acute anemia.
15-year-old Fortune Dixon also recounts how he used to endure the effects of sickle cell condition when he was as tender as 11 months old. He says health challenges that affected most of his early childhood also negatively affected other crucial aspects of his life, including access to education.
My mom used to look so sad because of my condition. You can even see that my height doesn't match my age. My peers are way taller than me. It is because my growth was hindered by sickle cell disease. But things are fine now because we were registered at Lisungwi Penplus clinic where we routinely get treatment.
Zione Juaula is the mother to the two siblings. She says before registering her children for Penplus clinic services, she could not have time to attend to development tasks in her household, since she used to visit Queen Elizabeth Central Hospital in Blantyre frequently for her children's treatment.
I can only acknowledge Partners in Health because if it were not for them, by now I would have lost all my children to death. Partners in Health supplies all the drugs that my children take. They give each one of them recurrent cash support. With this support, I am able to buy my children's basic necessities. I even bought a piece of land that I cultivate for my household. Partners in Health also provides transport to my children during their regular visits to Lisungwi Clinic. I am able to feed and adequately support my children because of Partners in Health.
Besta Mademvu is the community health worker for PIH in Ngwenyama area. He is the local health worker who introduced and kept guiding Zione's family on the need to report to the nearest Lisungwi Penplus clinic to seek treatment for the children's sickle cell disease.
My role involves conducting home visits, teaching households various health topics, and accompanying them to the hospital when need arises. For example, here, I make sure that the children adhere to their treatment routine and that they visit the hospital on their assigned dates. Partners in Health is helping a lot in this area. With their interventions, serious health-related cases have drastically reduced in our area.